webinar. We'll be sending a link to the recording and any materials along with an evaluation and a follow-up email that'll go out, I think, on Monday. So watch for that. And we didn't quite have the CE situation together in order to promote it before today, but we were able to confirm that we can offer CE credit for licensed clinical social workers for today's session as well as for tomorrow's. And if you are a certified community health worker, I think we have some options with independent credit. So if you're interested, reach out to Kelly. She can put her email in the chat and she can help as much as possible to make that happen for you. And speaking of Kelly, she's going to be live tweeting today. So we would love for you to join us, jump in the conversation, use our hashtag KVH2021. And finally, I want to thank our sponsors. So we have 4 sponsors this year: WellCare, United Healthcare, Humana, and Aetna. And we really appreciate their support. It's helped to make today's meeting possible. And we've been able to offer it for free. So we appreciate having that opportunity. With that, you can see here just a preview of our agenda. And I am honored to introduce our first speaker, Dr. Jamila Michener, a researcher and professor at Cornell University and author of the book Fragmented Democracy, Medicaid, Federalism, and Unequal Politics. You all may remember Dr. Michener from our 2018 annual meeting if you were there, where we explored how poverty, racism, geographic disparities, and other barriers to care that Medicaid recipients face have really far-reaching consequences for health outcomes, of course, but also economic opportunity and ultimately civic participation. Not something that we often think about in terms of Medicaid, but once you do, it all makes sense. Kara Stewart and I had the pleasure of hearing Dr. Michener speak at a meeting in Atlanta back in 2017, which feels like just lifetimes ago. And we were right in the middle of a multi-year campaign to protect Medicaid. I'm sure many of you remember that. And so at the time, Dr. Michener's words just really resonated with us. She was sharing research that she had done with Medicaid recipients that helped to explain the contradictions that in what people need and how they vote and even engage in public programs. And so now fast forward 4 years, a new administration, a global pandemic, and an environment that we're all in, where society probably has the least trust in government ever, possibly, which is really scary. And we are in a very different place here in Kentucky. While none of us can say that it's all positive, we have a lot of challenges that we're facing right now. We do have a really unique window of opportunity to strengthen the public assistance programs that make up Kentucky's safety net and to design our safety net in such a way that we eliminate the structural and systemic barriers that come between Kentuckians and their health. So very excited to hear Dr. Michener's thoughts on how we do that, as well as our other speakers. And Dr. Michener will also be sharing her latest research, examining how the design and administration of programs like WIC, Medicaid, SNAP, and KTAP shape access to public benefits and other outcomes related to health equity and civic engagement. And I'm probably most excited about the fact that she is now working collaboratively with Kentucky Voices for Health and the Cabinet for Health and Family Services to do research right here in Kentucky. And we're going to be able to apply those lessons learned to the work that the Cabinet's doing on the 21st century transformation. And we'll be hearing about that a little bit later this morning from Commissioner Miranda-Straub. And then following both Dr. Michener and Commissioner Straub, we'll be hearing from an amazing panel of Kentuckians who will discuss the real life impact of these public assistance programs and help us to reflect on what an equitable safety net should look like and how we can advocate to make that happen. So with that, I am going to stop sharing my screen and turn it over to you, Dr. Michener. I'm sorry, here are our lineup of speakers. I forgot to click forward, but I will let you take it from here.
Thanks so much, Emily. I appreciate that. Really thorough, and also I love personal intros. Sometimes intros are like just reading your bio, and then it just feels awkward. But what I love is that I've known you all for a while now, and I've learned a lot from you and have really enjoyed sort of working with you. And so now we can share from a place of having experience with each other. Okay, there we go. I'm going to share my screen and jump right in. Bear with me as I just expand it out here so that you can see just the slides and not everything else. Okay, here we go. So welcome everyone. I love that this is what everybody is choosing to do with their Thursday morning, because I think it's so important. There's a lot going on, and I think that when Emily said the difference between 2017 and now, like it feels like we've been through so much, and we're constantly going through so much, especially if you care about building a better safety net in this country and making sure that this is a place where people who are economically vulnerable, and even people who aren't, but who could be any day, have security, have sort of basic access to resources that will allow them to live with dignity. I think for those of us who really care deeply about those things, it's a roller coaster ride living in the United States. And one of the things that I think really helps me to sort of persevere through that is the ability to have conversations like this and to engage in contexts like this and to get sort of charged up, to learn, to expand in our thinking, and to work and talk together about how to move forward productively towards goals like this goal of building a better safety net, one that reflects our values and commitments as kind of thoroughly and robustly as possible. So I'm going to talk a bit about that today, and I'm going to draw on, as I go along, I'm going to draw on some of my own research to help situate and make sense of some of the different things that I'm going to say. But I want to start with just the big picture, because I think it's such an important context aspect of setting the context that we've all been working through, especially over the last almost 2 years now, which is a context where we've seen what happens to so many people when any instability, challenge, or precarity is introduced, right? The pandemic, if we didn't believe this before, or if we didn't realize how profound it was or how severe it was before, the pandemic certainly helped us to realize that many people are on a brink. They're on an economic brink, and in terms of how much savings they have, whether they have access to crucial benefits and resources, and a challenge like the pandemic really showed us how vulnerable so many of us are, right? So many people are, and not equally. Some people are much more vulnerable than others. But one of the things that the pandemic really flew in the face of, and I think pushed us, many people, to question, even those of us who didn't believe it before, it really underscored how connected and contingent our material lives are to things that are out of our control, right? The economy experiencing a recession because of a pandemic is out of our control. Us being more vulnerable to health crises because of a pandemic is out of our control. And the reality is that there are many things that were similarly and are similarly out of our control even before the pandemic. But what the pandemic did was push us to kind of reevaluate, and I think just better recognize the ways that in a context where we can work hard, we can try hard, but the amount of control that we have is limited. And at times we will need to be able to rely not just on one another, but on our government to provide us with a basic safety net to make sure that there's a floor below which nobody falls, simply because they're a person and they have inherent dignity. That means they ought to have access to a particular set of resources that everyone needs, right? I think that those kinds of things, those issues were brought to the fore for us in the context of the pandemic in a way that they hadn't been before. And if we think about the depth and the level of precarity and instability and insecurity that people have faced over these last 2 years, it's quite staggering. It's quite staggering. This is from a survey by the Commonwealth Fund, where they were trying to assess hardship that people were facing all across the country. And if you look at the numbers of people, the proportions of people who aren't able to pay for basic necessities like food, heat, or rent, who use up all or nearly all of their savings, who have to borrow money or take out loans, or who suffer from some economic consequence as a result of the pandemic, again, the numbers are staggering. They're also, of course, racially differentiated so that some groups of people, in particular, Black and Latinx Americans, are more likely to face these kinds of, face these kinds of challenges during the pandemic. But really, one of the things that we see here is both that there's inequality and that across racial groups, there are widespread hardships that emerged in the face of the pandemic. And of course, those of us who have been doing this kind of work and thinking about these kinds of things for a long time, well before the pandemic, know that the roots of this kind of hardship were laid well before COVID-19 ever emerged, and that there were other kinds of hardships that people were facing before it emerged. So part of what has happened in the last almost 2 years is that these things have been brought into sharper relief, but they were always a part of what was happening in our country. And the good thing about, I mean, there's not a lot of good things, I don't think, about the pandemic. But one of the things that I've appreciated is I have seen a shift in discourse, of recognition of hardship and of the various kinds of struggles that people face. We've seen people talking about housing and rent and eviction and those kinds of crises, I think, more than they had been before. And for good reason, if we look at both for people who experienced job or income loss during the pandemic and for people who haven't, if we look at this graph, it's really clear that there are significant amounts of people, especially among those who experience job or income loss, that are having a really wide array of problems. Everything from trouble filling your prescription, having to put off medical bills, and food insecurity, not having access to food. And of course, we know that all sorts of people experience these problems differentially, not just across race, but also if we think about across income. It's low and moderate income people who are experiencing these kinds of losses more severely, most severely. And of course, we can think about the most basic resources, right? Are you able to pay for food for yourself, for your children? It's staggering to think that essentially a third of Americans who experienced job loss during the pandemic struggled with even affording food, enough food to put on the table. And of course, these kinds of questions, making sure, do people have enough food to put on the table? Do they have roofs over their heads? Do they have access to healthcare? Do they have access to the resources that them and their families need to survive, and even beyond surviving, to thrive? These are essentially questions about how we use public resources and what kind of safety net we build or fail to build, and what the challenges and barriers are to building a safety net that's going to be able to meet the needs of everyone, and that's going to be maximally inclusive, and that in the process of meeting people's needs allows them to retain a basic sense of human dignity and an emotional well-being, right? So that you don't end up, in order to put food on the table, having to sacrifice your soul, as it were. And so these are questions that we've long been facing and struggling through and with, and they're questions that we continue to face and struggle through and with in a way that's been exacerbated. But one of the things we've also seen during the pandemic is how much intervention from the government can make a difference in changing outcomes in people's lives, right? So if we think about the CARES Act, which is just one example, and it's on the federal level, and there's tons more kinds of policies we can think about, but this is just one example, and it's a salient one, it's an important one. The number of people who are able to remain out of poverty, who would have otherwise fallen into poverty given the conditions, the economic conditions we faced over the last 2 years, it's just staggering. the amount of suffering and hardship that can be avoided, that we can forfend against simply by investing public resources in helping people who are vulnerable to economic precarity. And we saw that happen in a really unprecedented way during the pandemic. And one question we face now is, how do we continue to build on that basic logic? And one of the things that's really important to recognize is it's not a newfound thing that having a robust safety net makes a difference for outcomes around economic vulnerability and precarity. If we think about poverty, for example, and if we think about the difference that it makes when governments actually assist people with their basic material needs versus not. Of course, again, and this is something that I point out because it's important for us to keep in view, there are differences across racial groups, right? So it's not that all government assistance helps all groups to the same extent, but the similarity we see, the commonality we see, is that when we have a more robust safety net, when government assistance is available, we see these drops across all of the groups in poverty, right? And it suggests what we know, but what can often get lost, especially in our kind of current political and ideological milieu, where we are often focused on these partisan battles that lead us to help, at times, lose sense of what we know, what the knowledge that we have empirically. And one thing we know is that when we invest in government programs, it lessens human suffering. And, I always take care to point that out. And this is probably a group of people who already believe that. But one of the things that I'd like to underscore, and that I think it's important to underscore, is that that's not just a principle. It is actually a fact. We have the evidence to support that public services, public benefits, investments from government reduces human suffering. And of course, those benefits cost something, and we have to think about and sort of justify and work through those costs. But the cost, the payoff, is that we see fewer people experiencing material hardship, the kind of material hardship that's bad for your health, that stifles the growth and the ability for families to thrive, that stifles communities and their well-being and their ability to thrive. And so this is kind of the foundational logic for thinking about building a robust public benefits infrastructure, right? And of course, this isn't just true with respect to the CARES Act or to public benefits writ large. We can think about really specific pieces of legislation and policy interventions that we know have been really significant. So a lot of my work focuses on Medicaid, and I know this is something that is near and dear to Kentucky Voices for Health, and likely a lot of folks who are in this Zoom room right now. And even if we think about, and we know this, but it's still worth underscoring, because I do think it gets lost. It gets lost in the mix of conversations we have that can often stray from the basic realities of people's lives, right? And if we think about the benefits that come from a policy like Medicaid expansion, that when more people have Medicaid, they're able to see their physician, they're able to get a checkup, they're in better health, they're able to get a handle on their chronic conditions. What this means for people's day-to-day lives, for their material existence, is really difficult to underscore, and again, are difficult to exaggerate, right? It's more than I think most people can imagine. One of the things that I appreciate about being in constant conversation with Medicaid beneficiaries, in particular through my research, is that I actually get to hear people tell me their stories about what this means to them. We can see these numbers, a 30% increase in the share of people who got a checkup, or a 54% increase in the share of people who report excellent health, or an increase in the people getting care for chronic conditions. And the numbers can at times seem far away. And then of course, when you talk to people and you hear about what this means for themselves and for their children, it becomes less abstract and really just profound in our sense of what the possibilities are as we look towards building a really robust public benefits system and systems. And of course, on the previous slides, I've pointed out these different racial disparities. And one of the things to point out is that as we build out a stronger safety net, we also see reductions in a variety of different kinds of racial disparities. And you could put graphs up here that would also look at disparities around, disparities around gender, disparities around poverty and income. And in general, for folks who are economically or racially or in other ways marginalized or vulnerable, it's a strong public safety net that lifts them up and provides them with not just resources and support so that they can survive, but the ability to be upwardly mobile and to achieve opportunities that they wouldn't have been able to achieve had they not had the support of the safety net. And of course, this makes a difference in people's lives in ways that, as I said before, are often best underscored through their own words, right? One of the things that's really struck me, especially over the last year and a half in the context of the pandemic, as I've been able to do some qualitative research and talk to Medicaid beneficiaries and actually hear from them about how they're navigating the pandemic and how they're thinking about our public benefit system in relation to that, is how much people have underscored the life-saving possibilities and realities of the public safety net. And this is a mix of quotes, some from recent interviews and then some from interviews that I did years ago. And what I found is that this, like, Medicaid saved my life, is something that people were saying to me, certainly in 2012 and 2013 and 2014. But more people said more vigorously and more passionately in the last year and a half than really I've ever experienced in my research with Medicaid beneficiaries before. It was a refrain that came up again and again. Medicaid saved my friends' lives. It saved my husband's lives. And people don't just say this in a general sense. They say it and then give me examples of why and how, right? They talk about how they were facing conditions that they wouldn't have been able to overcome had they not been able to rely on a benefit like Medicaid, right? And again, people from different perspectives, right? This is actually from a woman I talked to who works with people who have substance abuse challenges. And she talked about how Medicaid saves her clients' lives, right? And this is actually someone, all of the quotes I've shown thus far are recent, but this is actually someone that I talked to from years ago. And I just want to point out that thread, that similarity, that this is an enduring reality that is, I love it. Someone says in the chat, I'm alive because of Medicaid. Yes, so many people say that kind of thing to me. It's an enduring reality, but it's even more true now than ever. I think that so many people have realized their vulnerability, and this is especially important around health, right? I'm the sort of person who thinks like, oh, I'll drink a lot of water and I'll eat well and I'll exercise. And of course, there's a certain privilege in being able to do those things and being able to pay attention to your health and invest in your health. But there's a way in which we have a narrative that puts a lot in our control, right? We can be responsible, we can make the right choices. And when we do those things, and if we do those things, things will turn out well. We'll be able to put food on the table. We'll be able to have a roof over our heads. We'll be able to be healthy. And that narrative, of course, both feels good. I have control. I can sort of do the things that it takes to ensure my own well-being and that of my family. And it also is a narrative that I think comports with the larger narrative that we have in the United States around the American dream and personal responsibility and pulling yourself up by your bootstraps and those sorts of things. And at the center of a lot of that is a kind of individual ethic, the things that we're doing for ourselves and for our families. But one of the things that I am always struck by when I connect with Medicaid beneficiaries and they talk about Medicaid saving their lives is that there is a public ethic that can often be missed when we focus on the individual ethic and on how much each of us can be doing with our own strength and our own hard work. And what that public ethic says is that even outside of people's individual hard work or efforts, there's a larger responsibility to ensure that everyone is living above a certain standard. And there are systems, and the healthcare system is an example par excellence, I think, of this. There are systems that make it very difficult, even for the most hardworking people, even for the people who've done all of the right things. Never mind the fact that we're frail and we're vulnerable, and sometimes we don't do all of the right things. But there is this emphasis that Medicaid beneficiaries have when I talk to them on that vulnerability, on how, they often are coming to a point in their lives where they need help, right? Because someone has gotten sick. There's an illness that's more than they can manage. There is insurance that costs more than they can afford. And this public ethic that public benefits ought to provide people with the basis for being able to navigate those challenges and being able to come on out of the other side of them whole and well and with their dignity intact. That's something that comes across, even though many Medicaid beneficiaries themselves will say, oh, well, I believe in hard work and I believe in people trying their best and taking personal responsibility. But I think especially in the last year and a half, one of the things that the pandemic has done is shown us how little control we have and how important it is to build a safety net that can be there for people when things happen that are beyond their control, or when our human weakness or human frailty or faults prevent us from being able to care for ourselves. And so, public benefits making a difference in people's lives, I think, is what this is all about. But despite the reality of that, and I think despite the profound importance of that, benefits are always on the chopping block, right? It's a battle. I was talking to somebody yesterday at a conference that I'm at, and they were saying that, well, it's really hard to protect Medicaid benefits because it's just not a popular program. And I said, that's actually not true. Medicaid is really popular. When we survey people about how they feel about the program, what we see is actually pretty significant bipartisan support, right? Where you're getting roughly 70% of people surveyed who have a positive, favorable view of Medicaid. And we actually see those numbers increasing during the pandemic because people understand even more so how important a program like Medicaid is. And similarly, there are a range of public benefits programs that are crucial to people's health and well-being. And many people recognize this when we ask people in surveys if they think people should be able to have this kind of help and support, if they think government should invest in these kinds of programs and policies. A large swath of Americans say yes. And even though there are partisan-based differences, there's a lot of bipartisan support for the idea that the government should make sure that people have food on the table, that they have access to healthcare, and so on and so forth. So despite the profound implications for people's everyday lives and their own voiced perspectives on how much these programs mean to them, and despite the reality that these kinds of programs are actually quite popular, there's a constant struggle and battle to invest in them, to develop them in a way that make them easy to access, that make them widely inclusive, and that allow them to be tools that push back against inequities, that push back against structural racism, and that push back against people living in poverty, constantly fighting for their existence and survival. And of course, one of the things that's crucial as we think about what it will take to strengthen and protect the safety net, power, voice, and inclusion. These are really key, I think, fundamental pillars in any effort to advance and protect and defend the safety net. So this is a Medicaid beneficiary that I talked to years ago, and I always like to incorporate this perspective from her in my presentations because it reflects something that many beneficiaries have told me, but it was just so well said by this woman who I call Angie. She just says, look, the people making the rules aren't experiencing the same things that we're experiencing. They don't have people in their families, people who are close to them, people who they love, who are being affected by the rules and regulations that are shaping the systems that we as Medicaid beneficiaries have to navigate. And this logic is why power, voice, and inclusion are key touchstones as we think about, well, what does it take? How do we strengthen and protect the safety net? Of course, power is part and parcel of ensuring equity. Often inequities are a result of whose voices were at the table, who was able to say, actually, if we pass this policy, if we implement this regulation, if we make this administrative change, here are the people who are going to be most negatively affected. And so thinking about what it means to build power, what it means to advance equity, is also part and parcel of thinking about what it means to strengthen the safety net. And I've been thinking about this a lot, especially over the last year and a half, as I've embarked in more research that's more focused and centered on the voices and inclusion of Medicaid beneficiaries. And one of the things that I've been learning from my research is how key voice and inclusion are to really transformative structural change. People will often ask me to be a part of policy conversations where they want me to offer ideas about potential policy improvements or changes or transformations. And one of the things I always say is that my best ideas come from what I learn from people who are experiencing these things right now in the moment in their lives. So including people who have the most at stake really opens up a whole range of policy possibilities, ideas, and potentialities. Because lived experiences, expertise, it's one of the reasons I'm so glad that in a little bit we'll hear from people who have that lived experience. And inclusion also means that we're more likely to develop multiracial, cross-class, people-centered, right? Organizing, advocacy, and governance structures, right? And so many of you who are in this room are likely interested in doing that. And I think focusing on voice and inclusion and building power in places where it's been attenuated is a really important pathway. But of course, there are lots of challenges to doing this. And these challenges emerge consistently in my research, not just in my research with Medicaid beneficiaries, but I've also been expanding this research out and having conversations and doing qualitative research that brings me into contact with administrators, people who administer public benefits, and with policymakers who are making decisions about rules and regulations around those benefits. And the challenges of the robust inclusion of voices really become clear in the context of talking to these different groups of people, right? So there are lots of voices, and the loudest voices aren't always representative. Of course, incorporating voice in a way that brings as many people to the table as possible, and that's as equitable and transformative as possible, requires effort, capacity, resources, and there aren't always incentives for this. It's much easier to just pursue the status quo, and there's often little accountability, few people making sure that we take these steps. And so working, and along the way, you have to work across agencies, across sectors, right? So, in any government, you have to work across multiple agencies. And then there's not just government, there's also nonprofits, and there's also social movement organizations, and lots of different sectors to work across. And in addition, there are political differences, not to mention the deep polarization and division that we're all facing around things like race and partisanship and, everything, it seems sometimes. So the challenges are real, but I think where I want to sort of wrap up and leave us off here is with an emphasis, not just on the challenges, but on the possibilities. What I found is that discourse and dialogue really make a difference. And, I'm one of the people that I think has very much been on the, we need more than talking, we need more than words, we need to move on, and we need to be on discourse and take action. And I think that's really true. But I've been able to engage in really transformative conversations with a wide array of people including Medicaid beneficiaries, policymakers, administrators. And I've been convinced that the work we do to broaden the range of ways that we're talking about and thinking about the safety net, right? So that safety net or public assistance or social services aren't bad words, aren't stigmatized, and aren't understood as something we should be trying to minimize and avoid, as opposed to something we should be trying to grow and nurture. And then, of course, partnerships and collaboration. This is an opportunity for me to quickly insert a plug for a partnership that I've been able to develop with Kentucky Voices for Health and different officials in Kentucky to do work research there to try to understand what Kentuckians who are receiving public benefits are experiencing and how we can make those experiences better so that they have more and better access. And so that access doesn't undermine their voice, their dignity, or their well-being. We've been working together to build knowledge and collect data that can then be passed on to state and local officials who can do something, who can take direct steps to make people's lives better in this way. I think it requires long-term thinking. So thinking about how the policies and the campaigns that we pursue now are going to build so that 5 years from now and 10 years from now, there are new possibilities and we're not just having the same conversations and fighting to retain the same things. And then, of course, we're going to have to think creatively about bridging across differences, urban rural divides, racial divides, social class divides, even partisan divides. What does it look like to bridge across those differences so that we can incorporate a wide range of voices, not simply for the sake of it, but so that those voices can help us get towards a more equitable, transformed future where we have a strong safety net that includes everyone who has need. And of course, there are other things. There are other things that you all, I'm sure, are thinking that you all can contribute to the conversation and that you all understand and know and have experienced as possibilities because you all have your own knowledge and expertise. And so I'll end there and just say, I hope that I laid a foundation for us to continue this conversation and to really think critically and closely and in a way that centers voice and inclusion around how to build and strengthen our public safety net.
Well, thank you so much, Dr. Michener. I feel like you always give us a new perspective, a new way of thinking about public benefits. I always learn something new, and it also gives me new reasons for why we do this work, and how we can be better advocates. So I want to know if anyone has questions for Dr. Michener. You can try to raise your hand. I sometimes miss that depending on how many people we have on the screen, or you can put it in the chat, unmute and ask your question. And if not right now, then we can also just continue on and have more time for questions at the end. All right, well, I'm going to give it another second, and then I'm going to start sharing my screen to queue it up for Commissioner Miranda-Straub. And Kara, do you want to say a few words?
Well, yeah, I want to say thank you, Dr. Michener. And yet again, I want to sign up for wherever you're speaking every week. Thanks. And to follow up on what we just heard about making government better, the stars have aligned. And exactly that coming up next. We heard Dr. Michener talk about the government. And when we all hear the word government, which we hear probably every day, most of the time people think about presidents, governors, and lawmakers, if we think about actual people at all. And those people are the government. But who I think about and who I invite you to think about are the people that are the backbone of the day-to-day, everyday functioning of our largest shared resource and our largest shared leaders, people like Commissioner Marta Miranda-Straub. And we are so lucky in Kentucky to have our government, our Department for Community-Based Services, which is this is a giant piece of interacting with Kentuckians every day, be led by Commissioner Miranda-Straub, who is an advocate herself, whose brilliant mind and thoughtful leadership skills and life experience are stacked on top of her Kentucky-sized heart. She invests in power, voice, and inclusion, the pillars we just heard about from Dr. Michener. Every day, if you've heard her speak before, those are the kinds of words that she uses in her job, which is a very important one. So I am so grateful, and I hope that you are also excited that Dr. Commissioner Miranda-Straub, is willing to spend her time talking with us today about the work she's doing to improve the experiences of the interactions with benefits, like we just heard about from Dr. Michener, on both sides of the telephone, both the people processing the benefits and to those folks who are entitled, who need that to save lives, like we've also heard about in our chat from folks here today. And I'm even more grateful she is here with us today to share her work directly. Commissioner Miranda-Straub.
Yes, thank you so much, Dr. Michener. An honor to share voice and space with you. What an incredible transformational work that you're lifting for all of us. Thank you. And a big thank you to Kentucky Voices for Health for being such a partner in holding us accountable and always nudging us to do better. So incredibly grateful to be here. For those of you who do not know me, this is my 46th year as a clinical and organizational social worker. I was a professor at Eastern Kentucky University for 17 years and was the chair of Women and Gender Studies, as well as Multicultural Student Affairs, and a professor in the social work program there as well, and retired in 2018 as the president and CEO of the Center for Women and Families, which is a large domestic violence and sexual assault nonprofit. So this is not my first rodeo, but it will be my last, since I failed retirement and decided to say yes to the governor and the secretary to, for the first time in my whole career, work for a bureaucracy. I am not a bureaucrat at all. I don't intend to be, and I'm terrible at it. However, I do believe that there is a window of time in Kentucky due to the leadership that we have, the benefit of the pandemic, who blew the lid out of everything we were in denial about or wanted to avoid seeing, as well as the racial reckoning, the largest civil rights movement in our history, happening right before our eyes, beginning right here in Louisville, Kentucky. So I am honored to be at the table during an incredibly difficult and crucial time for transformation. So I am honored to be in this role and to represent the Cabinet for Health and Families and the Department of Community-Based Services. I have been here 14 months and I have not gotten fired and I haven't killed anybody, which means I'm being successful so far. I'll keep you posted, keep your eyes open. They say we last about 18 months, so we'll see. Pushing the envelope everywhere I can. Next slide. When you think of DCBS, what comes to mind? No censoring, just put it in the chat. Department of Community-Based Services. What do you think? Write it down. Long holds, hold music, someone who takes Black children away from families. Yes, we're struggling with that right now. Child protection, Department of Current Bullshit. Yes, CPS, APS, repeats of paperwork, large bureaucracy. Revenge by divorced people, that does happen. Wait times. Yeah. Thank you. That is all true. I actually looked on Google what our reports, our clients and people were saying about us, and all of what you're saying is in there. We are in the process of looking at how do we become a 21st century agency? How do we decrease the barriers that you're naming? How do we address disparities and disproportionality? And how do we move from this archaic dinosaur of an agency to one that is responsive and accountable to the people we serve? Our staff is repeatedly being harassed, repeatedly being threatened, their lives, guns to their heads. So this is not easy work. In addition to being traumatized from walking along with people who are traumatized. And then we haven't offered much support for them as they do this work. And now giving this workforce crisis, they have opportunities to go work for a box store at double the money that the state pays without the trauma. So we are experiencing the largest turnover ever in our history. I've lost 600 staff in the last 3 months, which puts our cases at risk, and the people that stay are drowning in caseload. So we're not able to do the work that we need to do. So we are also in crisis and challenged, just being transparent to where we are. Next. So in process, DCBS is in the process of organizational transformation. So we still have one foot in how we've always done things, and we haven't really stabilized how we want to be and who we want to become. So that we're in that chaotic space of change. The goal here is to increase access to benefits and services for all, not just some people, apply an intersectional lens to all the work that we do, so that when we're working on equity, we're also looking at all the other pieces, provide the professional support, development and training, awareness and skills that our staff need to really handle the issues that come at them. Center the lived experience of both our frontline workers and our recipients of services in everything that we do. We started by identifying trusted advisors to help us devise an 18-month innovation plan. Those are existing or alumni, clients, families, and all families, as all family types, as well as youth aging out of foster care, to help with our frontline staff design an 18-month strategic plan for innovation towards a 21st century agency. We're now in the process of stabilizing that group into a council that will meet quarterly to be able to keep us accountable with the decisions that we make, the goals that we set, the kind of outcomes that we want to have. We are in the process of becoming an anti-racist, unapologetically anti-racist, multicultural, and inclusive organization. We practice a culture of safety. So when we find that somebody make a mistake, or we did something wrong, or a client challenges us, or an attorney, or a staff member, which happens a lot, my staff voice is roaring. I actually had a virtual meeting. I have virtual meetings with my frontline once a month, so they can throw at us what's not working and ideas that they have. I had one yesterday that I finished and I actually vomited afterwards. It is that hard. So I work with and for those who are willing to speak truth to power and who are willing to tell me what is not working and how I am not helping. And that goes for our clients as well, who have access to me, as well as my frontline staff. So the culture of safety means no retaliation. So when my staff goes to the legislature, actually they're being encouraged and spoken with and given permission to do that, to advocate for their clients, their communities, for themselves. That kind of social political content and empowerment is crucial, as well as when we make a mistake in front of the fatality and near fatality, where we're wrong, where we're not catching it, where we're not being, honoring of the lived experience. And also we're in the process of moving upstream, investing in prevention, being able to develop a division in our reorganization with approval from the legislature of primary and secondary prevention that will report directly to the commissioner. And the work that we're doing is not the brochure version. It is sustainable structural and systems change, which is what is needed. And the goal of that is so that it be institutionalized. So it's not dependent on the next commissioner or on the next governor or on the next secretary. That is hard work. Lots of internal resistance to our work. We're kind of rogue, as well as lots of questions coming from legislators and other folks about what we're doing. However, that is the eye on the prize. Hard work and must be done. It is about 30 years overdue. Next. So here is so that you know that we are within the Cabinet for Health and Families. And I want you to see the revised mission statement for the Cabinet so that you understand that our work directly sinks under our Cabinet to be a diverse and inclusive organization that provides programs, services, and support that protect and promote the health and well-being of Kentuckians and their communities. So this is key for the Cabinet as well as for DCVS. Next. With the help of the clients and staff that over 100 folks joined us and created that 18-month strategic plan towards becoming a 18 months towards becoming a 21st century. This is the draft that they've come up with. So this is our working draft right now. DCVS compassionately serves and empowers individuals, not we are the police for the state, right? We work through an innovative best practice system of care. We use trauma-informed, not just for our clients, but for ourselves, for our staff, integrating trauma-informed language with those that we work with and create equitable approaches to services. Next. So what we're having is an incredible amount of courageous conversations. I call conflict and courageous conversations the sand in the oyster. It is what gives us the pearl. Without the honest conflict and courageous conversations, we're not going to be able to do transformational work. So permission, encouragement to speak truth to power, I do. And I want my staff and our clients to be able to do the same. Engage, empower, and lift the voices of those with lived experience, both those who are at the front line and those who receive our services. Decentralize power so that those who are doing the work have influence and authority over their work. I want to give some of that to myself. I have never in my life had so much responsibility with such little authority. I need permission from multiple spaces that I need to advocate with. I don't know how anybody was ever in this position without being an activist for 35, 40 years, because I use every skill I've ever needed. So defining who we are. Who are we at DCVS? We are public servants, not police for the state. We are engaged healers using human-centered design and trauma-informed. We're a healthy and resilient staff and organization. This is who we want to be. This is who we are. This is our heart, our values, and we work collaborative to achieve human potential to the best possible way that our clients can have. This is who we are becoming. This is how we're defining who we are before we talk about what we do, so that what we do is reflective of the vision and the values of what we're here to do. Next. So what we do, you all know this. We oversee child, adult, and protective services. We are a lot of the time seen as, I used to have this when I was first told by an advisor that I should change from being my PhD in psychology to social work. I told him, I don't want to be one of those baby snatchers, Bible thumping people. So I got to be educated about the advocacy of what we do. I also got to be educated that we are not able to take a child away from anybody, that really is up to the courts, and evidence has to be presented on both sides in order for that to happen. However, we get called baby snatchers on a regular basis. There is disproportionality in the families and in the children that we serve, and that is a problem. And is again, we are doing a deep dive into this work. We provide childcare funding for childcare programming. We oversee foster care and adoption. We oversee the benefits of both SNAP and KTAP. and we oversee Medicaid certification. In addition to that, we have started primary and secondary prevention with the Family First and this START program around addictions. And now looking at both primary, secondary, and tertiary prevention. How do we keep people from coming back to protection and permanency? How do we work with family support so that they do the secondary prevention and stop families from needing to end up in protection and permanency because they get the resources that they need? And then we're looking at primary prevention, how to access resources to those before they enter our system. So once they enter our system, how do we catch them and provide the resources and support they need earlier so they don't end up being at the emergency room of protection and permanency? And then how do we get resources and education and connect people with our partners in the community way before they get to the cabinet? We are in progress. We have designed as a result of COVID. We overperformed ourselves using what we were mostly working virtual. So we were virtual about 80% of us, and 20% of us stayed on the ground, meeting with families and youth at risk in porches and in parks and in backyards. However, now all of our public facing offices are open, but we have a reduced space and reduced staff because we've been able to do a hybrid model. What that does is it offers virtual work for our staff. People can might have had a crisis and can then step back and work from home. So they get to recalibrate, they get to have more of a work-life balance. Our clients are able to access us in both ways. So we are now committed to a robust workforce and a robust that is both in person, reduced in person, and strengthened in the virtual world. And we're committed to fighting for a living wage for our staff. A lot of our staff receives and qualifies for the same benefits that they're qualifying our clients for. There has been no living raises in over 10 years. And we're experiencing the largest turnover in at least 15 years. I've lost 600 staff members in the last 3 months. Folks are able to make at Walmart and at Target and at Chick-fil-A double what our staff makes. It is unconscionable, and that needs to change. And we are working on that. The inclusion of clients, partners in the design and evaluation of our work. So I love your graphic of nothing about us without us, is making sure that frontline staff and clients are at the table as we problem solve the issues that we have. We're in the process of redesigning a new business model for KTAP. KTAP disincentivizes when people have money in the bank. It takes benefits away as opposed to incentivizing being able to have a contingency fund. We're also looking at more entrepreneurial opportunities, more opportunities to build bridges between when people receive the services and they either get an education or a craft or an opportunity to make a living wage, not a minimum wage. Supporting entrepreneurship. Our secretary is very much in that process with us. Increased kinship care, youth and children who can stay connected to their roots, who are able to celebrate the holidays, who are able to remain connected to their family roots is really important. So that is that we have lifted and continue to lift kinship care before foster care. We love foster care, is needed, but it's a temporary while we work on reunification, if at all possible, or adoption. So if we can do kinship care, I think that mitigates the trauma that our youth receives, and also the cultural trauma of being disengaged from their culture. Decrease of out-of-home care. We have made a commitment to reduce the residential care for our youth. We have reduced about 1,000 as a result of Family First, and we continue to go down, working with our partners and community wraparound services. We have several pilots right now where those youth or kids that would have gone into residential will be seen in the community with our partners, and we'll be able to have teams in their communities. What happens both with addiction and with mental health is that it's really hard to reentry. And although there might be really good work happening in the residential, when they come back to the community they haven't been part of that. The family hasn't really been part of that. So we just piloted 3 pilots. We just starting that in Harlan, Clark, and Harlan, Clark, and I forget the other one. Anyway, we just had the press conference last week, and it's we're starting a program with VOA where families suffering from addiction, the children stay with the addicted family member, and they're bringing in capacity. VOA is bringing capacity to our front line to bring that addiction expertise. So how are we doing this? We continue to strive to serve, to be inclusive, to be accessible. That includes my leadership, to be collaborative, and to be transparent. As soon as I know, you know, that's what I promise my staff. That's what I promise you. Next. So the foundational pillars of doing this work, equity, both based on grounded on social and economic justice. We're looking at both race and poverty, an incredible deep dive into our disparities and disproportionality around both. Second is trauma, resilience, and engaged healing, both internally for our staff and externally. Families, all children, no exceptions. Health, behavioral health, mental health, and the opioid crisis. And my wheelhouse, organizational excellence. How do we design, implement, and evaluate and continue to recalibrate the work that we're doing along the way? Next. So I wanted to give you some slides just to have an understanding of what we're talking about. When we talk about equality, is of course we distribute the same resources equally to anyone. When we talk about equity, is we disperse the resources congruent with a need. So for example, you know, we have populations like a lot of our brown families, a lot of our Black families, a lot of our Appalachian families who have a lot more needs and have had historical components around race and poverty. So really, how do we develop that our resources are equitable, so that if I have $10, you may only need 1, but I may need 5 based on where I am. But the whole goal of both equality work and equity work is really to get to a social justice, next slide, component where there is no barrier, where everybody has access, where we dismantle this equity piece where we have somebody who needs a larger push up to be able to look over the fence. Well, there should be no fence. So we're working on tearing down that fence. Next. So economic support, lifting our economic support staff who have been the stepchildren of DCVS, because really I'm talking about poverty and economic support as a safety net is crucial. So financial support and meeting basic needs is non-negotiable. We are doing panels, speakers, roundtable trainings around both poverty and race. We're deconstructing the stigma and assumptions and prejudice about the clients that we serve. From our legislature, from our own staff, people really don't get poverty. There's a lot of assumption of fraud. We have less fraud than folks who at the banks who actually give loans for mortgages. So poor people are not out to scam us to the degree that folks think that they are. Plus, we don't give you enough. If you're going to commit a crime, we're just not the people to come scam. Doing a lot to educate and inform about what the cost of being poor is. That most of the resources goes for food and shelter and utilities, and there's not much left. And to incentivize rather than punish when folks are doing well and they get better job. We don't give enough to be scamming. So here's some information that I just want to give you. We got this from our Family First partners. Each additional $1,000 that states spend annually on public benefit programs per person living in poverty is associated with 4.3% reduction in child maltreatment. Look how powerful that is. 4% in substantiary child maltreatment, 2.1% in foster care placement, and 7.7% in child fatalities due to maltreatment. That is prevention. That is secondary prevention. These economic safety nets prevent the next phase of maltreatment, of fatality, of displacement of children and families. So I will leave you this because you all are going to get the slides, hopefully, from both of us. But each additional 13.3% the states invest annually in public benefit program, which is about $46 billion nationally, save us $153 billion in the long term due to reduced maltreatment. So even if you're just talking money, not lives, hearts, family, trauma, displacement, repeated placements, right? Unwanted. Look at the money. Just look at the money. It's huge. Thank you. Next. So child welfare intervention augments concrete support. So here are the concrete supports: Medicaid, paid family leave, childcare, SNAP and WIC, and legal support, economic supports, minimum wage increase for everyone. Everyone needs to make a living wage. We are internally fighting with our own folks and the legislature about a living wage for our staff. Without a competent, valued, trained, and well-paid staff, we're not able to serve. And we're not able to serve at the capacity and quality that we must serve and that we're being challenged to serve. Employment, earned income tax credit, public benefits such as TANF, child support, and sustained income support. Next. Thank you. I'm glad you agree with me. I love that dog. Here is the collaborative process that we're engaged with across all of the cabinet, not just DCVS, because Medicaid is part of us. Behavioral health is part of us, right? All adult is part of us, aging adults. So we cannot having all these invisible barriers across the cabinets and commissioners. So we are working together to be better together. Cabinet-wide trauma and resilience core leadership. We also have cabinet-wide leadership teams around race. We're looking at organizational and department resilient roundtables. How do we become a resilient organization? Fostering resilience supervisor training so that self-care is not seen as a bougie luxury, but as a necessity to the work that our staff does that needs to have the process and the policies and the support that is needed if we're going to change how we treat our clients and how we move forward in a new way of doing business. And marrying the compassion to resilience. I do those as foundationals for the cabinet-wide about what are the basics, what does it look like, these are the symptoms, and this is the stuff we can do individually, as a team, and as an organization. Next. These are all the pieces I already mentioned, really moving beyond individual responsibility, adding debriefing groups when there's a critical incident, and there's many of them, adding caring circles so that folks have somebody to talk to right away when things happen, and developing communities of practice. The continuum, in case you do not know, I think I was brought in by the secretary, not only for being really being committed to systemic and structural change organizationally, but because of my experience around trauma with trauma workers and with physicians and nurses and pharmacists. So the continuum looks like chronic stress. So if you're under chronic stress, if that's not addressed, and you can stop at any level, but if that's not addressed, what happens then is burnout, and we're all familiar with that. We lose our heart with the clients. Our clients become a problem. We become crunchy. We become reactive. Compassion fatigue. I don't have any more care. I can't open my heart any further. It already has stretch marks. Vicarious trauma. I catch the trauma because trauma is contagious regardless. And then secondary stress and trauma, which ends in impairment, medical illness, psychological illness, loss of work, loss of time. Accessibility and empowerment and authenticity and vulnerability modeled from the top down, and creating both staff and clients as partners and trusted advisors. Next. So pending, this is where we want to go. Pay equity, raises, retention, recruitment, and staff safety task force. We have had a large increase in threats to the lives of the families, the children, and of the workers that we work with, including my own, my directors, and frontline workers. Foundational training to serve DCVS certification. So instead of the academy, where everything was pretty academic, it's hands-on skills and competence that are needed to certify anybody working with human beings at DCVS will have to have these basic skills, whether you have a degree in human services or in social work. Institutionalize the trusted advisor so that they will become a council that will be part of DCVS. Implement and evaluate our 18-month innovation plan. Alternative response teams. We are putting in not only raises, but hiring 70 to 100 experts in complex trauma that could take the very traumatized families and children and see them 5 to 10, no more of that caseload, and then act as that supervision, that support, that coaching for our younger staff who do not have that experience. So they will have alternative response experts around trauma and support of our primary young staff, all that could have retired. Organizational infrastructure, so building policy and processes to be able to do that. And of course, establish a division of prevention, which is now in a reorganizational plan, and continue to put infrastructure around secondary trauma for our workers. Thank you. So next slide, and I think I'm there, is that we are in process of listening, of learning, of implementing and evaluating along the way. Thank you. And I think that's it. Yeah. Thank you for all you do. We are one of many who are doing transformational work. So thank you.
Thank you so much, Commissioner. That was so hopeful to me. We had a question already in the chat. We also had some other people thanking you for doing what is very sincerely hard work.
You're welcome. And I will take any questions.
Well, Robert Brown asked if you think the changes in retirement plans for state employees.
Huge.
Okay.
The changes in retirement plan really fueled our people retiring. Anybody that could did. And then it's very hard to attract anyone because we're simply not competitive. We have folks making $12 an hour. So the reality is that no one, not our staff, not anybody else, can live on that pretty much anywhere in the Commonwealth. And then when they took when they transferred the retirement pension, we have registers open for positions that we don't have anybody applying because of that change in the patient. So a huge cut on multiple levels, folks retiring under the old plan and new people not wanting to come in. One, because our pay is not competitive and is very low, and our work is heartbreaking. Heart is not just hard, it's heartbreaking. And if your heart doesn't break, you're in the wrong job. So it requires that. But the fact that we don't pay what folks deserve to be paid, and we certainly do not have the capacity to compete in this current market. The gift of COVID, it lifted the veil. We are not a good employer. We do not pay people necessity. People who never needed us need us now because they were hovering on that ledge of needing assistance. So we have this incredible chaos of people needing us more than ever because of where they are, and us having the least staff that we ever have, at least in the last 15 to 17 years. We are in crisis.
Oh, I agreed, co-sign, and say it louder for the folks in the back. We do have some other folks here to talk with us today. And we're going to ask that they introduce themselves with a little blurb about what they do and where they live. I see this starting to pop up. I see Celine and David and Kiesha. There you are. Just checking to make sure everybody was here before I announced you. Good test, right? So you all can come off mute. And how about let's start with Kiesha then, and introduce yourself and let folks know why you're here, what you do, and where you live.
Hi, my name is Kiesha Curry, and I am from McCracken County, Paducah, Kentucky. I've been a resident of this great city for the past 14 years. I relocated here as a single parent. And shortly after relocating here as a single parent of 2 boys, I found myself looking to community resources. Currently, I work as a behavioral health consultant for Signature Healthcare Services like I said, as a consultant. My trade is social work. I've done social work for the past 15 to 16 years now in various areas, ranging from foster care and adoption, HIV/AIDS, and now I'm in long-term care. I enjoy what I do, love what I do. If it had not been for public assistance, resources of Medicaid and SNAP benefits, I would not be where I am today. I remember when we were receiving SNAP benefits or food stamps, the actual coupon books back in the day. I was a recipient of those, and I've been periodically on receiving benefits periodically throughout my life as a single parent because of hardships and unexpected unemployments. But I am very grateful for where I am today. I'm grateful for the resources that were put in place to aid me to where I am. And I do contribute to, the public services has allowed me to get a foothold and to advance forward in what I do. And I'm just very appreciative of that. And I thank you for this opportunity.
Thank you, Kiesha. And then let's see, we've got, how about David? Come off, unmute, man. All right, there we go.
All right, sorry, I thought I mispressed the button. Hi, I'm David Roode. Yeah, so I'm a symphony musician, actually. I'm a trombonist, and I've been working in orchestras for a long time now. I studied music at Duquesne University in Pittsburgh, and then I was in the Memphis Symphony for a while. Then I went to Europe, and I lived in England, and then in Denmark for a little while, and now I'm back. I'm living in Northern Kentucky, and I have a few positions in orchestras around the region. But the reason I got into healthcare was that years ago I ended up being one of the plaintiffs on the lawsuit that stopped the former governor Matt Bevin from adding work requirements to Medicaid, and then I kind of got connected with Kentucky Voice for Health through all of that, and I've just sort of been an advocate for healthcare generally since then. I'm actually now on the advisory board to the governor for the Kentucky Health Benefit Exchange. So I've kind of got my toe in this water a little bit, but I'm kind of in a unique position in that I've have experience with Medicaid, with the marketplace plans, and also living in countries where there was socialized healthcare. So I kind of have a pretty broad perspective on all of it. So, but I'm really happy to be here, and thanks for having me.
Thanks, David. And Celine, can you tell folks who you are and where you are and what you do?
Yeah, hi everyone. My name is Celine Mutuyemariya. I am a community policy strategist with the Louisville Urban League, and it's a fairly new role for me. And a lot of what got me into this role was my personal and professional experience with government programs and various social safety nets, everything from, being on free and reduced lunch when I was a kid to relying on food stamp programs in Chicago when I was in grad school and trying to work towards my career. And so in a professional sense, I have been I was a community health worker prior to this role. And so I had a lot of experience working with clients and providing support with navigating various benefits and programs. And that really gave me a lot more insight. I think on the personal level, I experienced a lot of the things that have been discussed today. And honestly, a lot of that experience was pretty dehumanizing a lot of times. But then I also experienced just not having a lot of information about how these benefits worked and how I could use them to my advantage and who I could talk to about them. But then, yeah, on the professional level, I really got a lot more insight and a lot more experience with a variety of experiences outside of my own. And a lot of that led to me being really, really angry and frustrated, and just like recognizing how much all of these things were limiting the clients I was working with from reaching their full potential. And so from that frustration, like Councilman Arthur says, I turned my anger into advocacy, and now I'm in this new role where I try to amplify the experiences of folks I've worked with, my own experiences in trying to build a better world for all of us when it comes to support and benefits. So that's me.
Yeah, so I think that you all are reiterating some of what we heard from the data from Dr. Michener and from the commissioner about people's experiences and investing in improving those experiences. I kind of want to do a quick little just real quick, what was the most positive thing that you personally experienced? Well, I guess personally or professionally with accessing and using public benefits first. So what's the most positive thing, Kiesha, that's happened for you in accessing or using public health benefits?
Well, it actually helped me, like I said, to get a foothold on where I was, what my situation was at the time, allowed me to step back and reevaluate things. The most positive thing about it was I was able to go to school and complete my degree using the resources that were in place for me and through the programming that the system had laid out. So that was my most positive experience. And today I'm a social worker, and I think I'm thriving at this point where I am.
I just needed to feel a little pick-me-up personally from thinking about all of the challenges. So thank you for meeting that need for me personally. And then if you're so moved, David, do you want to throw in a positive?
Yeah, I mean, just like a positive from having healthcare. I mean, when I was
yeah, that's fair.
Yeah. I mean, I was in the Memphis Symphony before the Affordable Care Act was passed, and the orchestra, well, from my position, was a part-time position, so I didn't get healthcare through them, so I had to buy my own insurance plan, and I was like in my 20s and could sort of see it, but every year the premium would go up, and I could sort of see the writing was on the wall. In another 5 or 6 years, I just couldn't, afford it. When I went to Europe, I was like, there was a lot of relief that, in England and in Scandinavia, you have like socialized healthcare, so I didn't have to worry about that. When we were coming back to the USA, that was a concern for me, was like, what's going to happen with healthcare? But then, at that point, the Affordable Care Act has passed, and so being able to like just have a healthcare plan that I can afford. Same for my wife, who's not a U.S. citizen. She's not eligible for Medicaid, but she's able to get a plan through the exchange. So being able to go see the doctor and not have to be worrying about that. It's actually really it takes one concern off the table, really. When life is hard enough as it is, so we should try to make it easy on ourselves if we can.
And I'm happy to jump in with one. And this is kind of on a personal level, but I remember in high school, I had a counselor who told me that since I was on free and reduced lunch, that I could access like AP testing for free. And then, so like, that was a huge benefit for me and a motivator for me to take AP classes, and like just understanding and having someone who cared enough to help me make connections between how being in what part of one system could actually positively benefit me in another way. And so that motivated me to take more challenging classes. And then I found out in Kentucky, there's actually like a benefit where you can get funding for college for kind of pursuing that path. So the positive experience for me was having a counselor who could help guide me through that process, because otherwise I would have never known to tap into those resources.
That's awesome. So, while we're being and becoming and in this sort of the struggle of making the pearl, I just wanted to keep in mind that it's all worth it. Just from listening to these three folks right here, and everyone else who's here probably has some similar experiences, but just to let a reminder that it's all worth it. And thinking about the transition, how do you all think your interactions with CHFS workers or trying to access, maintain your benefits has affected, if at all, your opinion of the government? Or what have you heard from family, friends, or clients about just, do you think they've connected that to the government? Kiesha?
So for me, I've had positive experiences and negative experiences as well. Now, because I'm in the place I'm in now, I can understand, and listening to Commissioner talk, I understand why I was probably getting a lot of, I call it pushback, or, kind of disgruntled worker, or however you want to call it, or however you want to name them. But the experiences have been, there was a situation when me and my husband both found ourselves unemployed, 2 small children. And prior to that, we were living life. I mean, we were okay, but unexpectedly unemployed. We had to apply for benefits. And one of the workers looked at me and told both of us that we needed to sell our vehicle, which was, an up-to-date vehicle that we were able to afford at the time, but was no longer able to afford, or barely afford. Told us we needed to sell it before we could get benefits, and that was something I didn't think that was the case. But that right there kind of made me feel some type of way in applying, because first of all, that was my first time ever applying for benefits. I've never known my mother to apply for benefits. She was a farmer, so we lived off the land pretty much, but it was disheartening to me for somebody to approach me in that manner. But I've had some cases where I've applied and the worker walked me step by step, hand in hand, and guided me throughout the process and able to get the resources that I really needed, for me and my children. So, there have been good and there have been bad. I don't want to say that it's all bad, because there are some workers out there who genuinely care, and like it was said earlier, their hearts are just stretched so thin now that sometimes they don't have much more to give. But now from the place I am, like I said, I am now, I understand more about. So when I do talk to people in the community who talk about applying for resources and how they don't want to go through that process because of the negativity or because of the stereotype of the process, I try to talk them through and say, hey, it's not all bad, and it can be very helpful in the end. The resources are available, and you need to assess those resources if need be, to better enable yourself, equip yourself, or prepare yourself for your next step ahead. So it hasn't been all bad for me.
And I'll jump in because I can relate to that. I've had both positive and negative experiences, mostly with supporting clients with navigating the process, being on three-way or having the client with me while being on the phone. And for me, I started to realize, like, when I would ask certain questions, so many of the folks I was talking to were like, this is what I have to do. This is my job. There's not much else I can do, as far as when I would suggest, well, can this happen? Can this happen, to make that resource more accessible for my client? And I started to make connections, and I would figure out, like, well, if you can't help, who can help? And really following that line and that chain of who really is in power here and who is really setting the stage for what the experience of this benefit looks like. And so that taught me to kind of dig deeper and try to understand, because it started to feel like almost like a divide and conquer. Me and the worker on the phone, none of us can really do much to change the certain circumstances that we're in, and we're equally frustrated. So who has the power to change the experience that we're having? And so for me, I started to make connections to government and policies, and how at the end of the day, both the DCBS worker, my client, and myself, we're all trying to live with what we're given, but we can be given something better if we find out who has the power to offer something better.
I'm grateful that you got to that point, Celine. Very grateful. So we all listened to Commissioner Miranda-Straub talk about her plans and work, her heavy work to improve DCBS and transforming DCBS to be more inclusive and responsive. And I am very curious, what was your immediate reaction? If you've transitioned since then, what's your reaction now? How are you feeling about that? How did that hit you?
absolutely amazing. It is absolutely amazing to see and hear about the changes that are being made, the changes the commissioner is implementing to not only to address recipients, but also the workers. Because I do agree that it has been so overlooked. They're underpaid, under pressure, and we as recipients take for granted or assume that their day is going fine and everything's fine. And I never thought of the fact of their lives being threatened. But when you're in crisis, a lot of times, and you feel like you're not getting the help that you feel like that is due you or that you deserve or that you need, that can have you feeling very emotional and have you saying things that you really don't mean. So I never thought about the standpoint of the workers being abused. And that shed a lot of light to it. But the overall transformation that she's making within DCBS, I think is absolutely amazing. I think it's going to impact not only the workers, but those who receive those benefits in the long run.
David, I don't know if you want to jump in.
No, I'm just listening. I love it. I think it's great. I mean, I've got a lot of, just thoughts about, I don't know. I was thinking about the last comment about like how like my experiences with the services, and then also kind of like talking to my neighbors and stuff and other people in the community and thinking, and just I'm still putting together a lot of thoughts in my head. Maybe Celine, you go ahead. I'm still thinking about stuff.
Yeah, I'd be happy to. I'm actually also very excited as well. And the thing that stuck out the most to me is the last slide of listen, learn, implement, and evaluate. Because I think so often I would get so frustrated with calling a system or a program and saying, well, it would really help if this was available, and saying, well, we just can't do that, or that's just not what we do. And I'm like, well, can you try, if I can make you understand how meaningful this would be to this person, like why not at least try? So I appreciate the fact that, it's a system approach to change rather than expecting individuals to bend and mold and jump through hoops and hurdles and pray that they can actually get to the finish line of whatever it is that they're pursuing. So the fact that at that system level approach, we're placing the onus on the system to listen and to, evaluate like how they can change and be creative about how benefits can be given in a different way. Like that's a great first step to changing this this world that we're living in, because I think systems rarely listen or place the onus on themselves to change and meet the needs of the people that they're serving and meet people where they're at.
Yeah, I mean, that's great. I agree with all this. I think if I think to the challenges I had, and a lot of this was in the previous administration where they were kind of trying to undercut it very deliberately. But I kind of feel like a lot of the challenges were bureaucratic, and having, like, for example, being given one benchmark of, okay, if you are make this income level, you're going to be off of Medicaid versus on Medicaid. And then I call back like the next week, and the different person will look at exactly the same numbers, and they come to a totally different determination. And so I kind of got to the point where I got so sick of calling and trying to get more clarification. I just finally said, well, here's my taxes, you tell me, and that kind of approach. And when, especially, recently in the pandemic, when all the orchestras shut down, I was on unemployment, but just getting the unemployment set up was weeks and weeks of fighting through red tape. And the thing is that, I'm going to go down a weird rabbit hole here, but just bear with me. Like, when I work with orchestras, many times I serve on orchestra committees or go to board meetings or stuff like that. And I work with management on outreach and stuff like that. The conversation you keep hearing is, are we relevant in our community? When it's easy for me as a classical musician to say, oh, I love Mozart, I love Brahms. Of course it's relevant. But actually, if I was a postal worker or a person at Walmart, would I think, oh, I'd like to go hear the symphony this week? And an orchestra has to make, or an arts organization has to make themselves relevant, even though it may not be readily apparent to us. But I think it's, in a weird way, we're kind of in the same situation in healthcare And we might think, well, of course it's relevant. Why would we even ask this question? But we do have a history of electing politicians that undercut it. And there's a voting disparity too. And I'm not trying to dismiss that. But my point is that if we can show how relevant this is very viscerally in people's lives, people won't be voting for the next, Bevin or the next politicians who are going to undercut it. And people will justify getting on board. I think the barriers make it hard. If I talk to my neighbor across the street when when the pandemic hit and all this unemployment happened, I said, "Hey, man, they've got this government assistance. You should, And he said, "Oh, I was on hold for an hour and I gave up. I'm just going to figure it out myself." And I kind of realized that many times my path to access has been through sort of like a lot of persistence and having to go and research my own and find the programs. And if there's a way to make it just more available, I think that's really the path. And I think the more relevant we can make ourselves, that makes the fight easier, I think. It's my opinion.
So maybe we should raise some Kentucky voices for health. Maybe that's a good idea to come out of that, pun intended, strongly. And I hope that when we get some swag out there, everyone marches around proudly with that we are both Kentucky voices and Kentucky voters for health, because that hit me hard, David, that, maybe we do need to argue for our relevance in terms of people needing a safety net and the importance of that in different ways.
Ms. Kara, in all due honesty of it, to be a little transparent, for me, when we're talking about electing politicians who care, when you're in a place that you're receiving benefits and you're in the system, you feel as though you're not being heard. So why go vote? And I'm being honest, because that was me at a point in my life where my voice is not going to be heard because I'm here, I'm low man on the totem pole. I have no voice, but that is completely not the case. You have a voice regardless of where you stand. But a lot of people, and we have to educate people on this. It doesn't matter where you are on the economic level, you still have a voice, and your voice is important, and that voice can advocate the change.
Well, blending in that, so Kiesha, I got a fun little announcement for you. What you just said, which is obviously true and like true in your personal experience, and that's the highest level of truth for me personally, is that Dr. Michener has also proven that with data. So I'm actually going to pop over and real quickly ask her to respond to what you just said, because it was such a beautiful encapsulation of so much of her research.
It was, and I had to stop and start writing down what I was like, I need this in the notes. Like, I need to remember this came up in the conversation. Yeah, oh, it's being recorded, great. Yeah, I think this is so important. Thank you for saying that, Kiesha, and David for bringing up this issue more generally. I think a lot of times there is a desire, and I understand why, to almost be apolitical in these conversations, because we're worried that once we make it political, and sometimes people think political just means partisan, that it's just gonna be a mess, right? But at the same time, we always end up back at a core reality, which is it matters what elected officials do. And so it matters who they are, it matters what their values are. And not even so much just whether they're Democrats or Republicans, but like whether they understand the value of a program like Medicaid, whether they understand what it means to people like Kiesha and David and those of us who have used those programs at some point in our lifetime, and whether they're actually responsive to those people. Because I've talked to elected officials who are like, yeah, Medicaid's important, but my constituents don't like more government funding for X or Y programs. And so they might not think about Medicaid beneficiaries or public benefits beneficiaries as the real constituency they're serving. This is why I think I talked about power as one of those key pillars, because the folks who have been talking these last few minutes, who have been telling us about their experiences with these programs, having the power to influence what elected, not just who gets elected, but then even once they're in office, being able to hold them accountable and influence what they're doing. That only happens if power is built in those communities and among those people, so that it can be channeled to actually influence outcomes. And right now that's really hard to do because of the deep partisan divisions that we have, but it's not impossible. And I mean, I see that as part of the work that, that Kentucky Voices for Health is doing, but there's a lot more to be done and it's really hard. But I love that we came back to this because it's a really fundamental piece of things. Love the dog too.
Yeah, that was definitely in celebration of what you're saying and blending it with the other folks here. So I kind of want to open it up to anything that you, Celine, and then we'll rotate through, haven't said that is, on your heart or something you came to this thinking, I want to make sure that we discuss. Blank check.
Yeah, I mean, I think in line with what was just shared and what I mentioned before, as far as, following the ladder to see at the end of the day who has the power. And oftentimes what I found is ultimately a lot of the power lies in politicians and other members of our communities who would be considered decision makers. And the disconnect for me was, I felt like in conversations I would have, sometimes they're just so far removed from the experiences that I've had in my personal life, and then I've seen my clients experience as well, that sometimes there's a lot of, even sometimes, unintended decision making, or like not really having a full grasp of the picture of like the effects of what decisions that they make, because they're not part of certain communities or they have not had certain experiences. And so I think it's critical for decision makers and power holders to listen to what people who are outside of their experiences need, especially when they have the power in their hand to affect what it is that those individuals need. But as far as figuring out how to, because I think the difficulty is that people are so burdened by all of the complexities of navigating these systems and trying to survive, and really they should be being given the space to thrive, that it can be hard to engage in that political process and that civic engagement process. But I think sometimes if you can make connections, right? So what are the things that frustrate you the most? Because that's what it was for me. The things that frustrated me the most were what propelled me to figure out, how can this be changed? But I think so many of us think, well, this is just how it is, because we haven't seen or experienced opportunities for change. And I'll just say one quick thing. Kentucky Voices for Health campaign, as far as the work requirement that was going to be coming from Medicaid, that was happening when I first became a community health worker. And to see the way that level of organizing actually ended up having a positive effect of not having that work requirement come, that really blew my mind. It was like a huge teaching moment, and was like, wow, so it is actually possible to take something so daunting and change it, right, with the right amount of people. So that was a huge lesson for me. But again, I don't think that a lot of people have opportunities to see things like that, or maybe even like stick around for as long as some of those changes can take. So how do we offer tools and support for those, for different people to be able to enter these processes and have their voices heard and, advocate against the things that frustrate them the most in life?
Yeah, I think maybe that's I guess if there's one idea I'd sort of want to leave with is just kind of controlling this narrative of how we just approach the whole idea of just the safety net. And like there's this idea in my mind of like the rising tide brings up all ships, so so if my neighbors does well, then my neighborhood, their children are growing up in a better life, and that makes my neighborhood better, and my house value goes up. It's sort of like all connected. And as long as, I think, if we're really focused on that and presenting that idea, that lifting up everyone in the society is going to, it raises all. So I think that is maybe the path to get the political partisanship out of it, I think, because then I feel like that's something we can sort of all agree on. I like to think, at least. But yeah, and then I think in hand with that, just making sure that, yeah, getting the resources to the people who need, and making the resources easy to access. And I think a lot of the fight is getting people aware of the resources. You know, I have a friend, another musician who lives over in Ohio, and he has diabetes, and he's often struggling with just like getting, you know, health insurance, because he sort of makes enough money to not qualify for Medicaid, but not, you know, but he's sort of not enough to get a decent healthcare plan in the exchange. So he's a little bit in the crack. And so I feel like so I'm always trying to connect him with resources over in Ohio. But I just think like if people are more aware without having to like kind of fight through red tape to get just information, that's really the battle I think we're fighting. And then if the more people are on Medicaid, the more people or just all these programs, the more people have access to this, then I think the next politician that comes along and says, oh, we're going to do all this stuff, you start cutting these things, it's just not going to resonate as well. Because when it's someone else's Medicaid getting cut, then it's easy to say, well, you know, as Dr. Michener, you said, that there's this idea of like individualism in our country, you know. A lot of people buy into that and say, well, I'll take care of myself, you know. But if we're kind of keeping the emphasis on how this helps everyone, and that in turn helps me too, because I'm part of everyone, I think that's the way to keep pushing. So I guess that's my thought about healthcare in general and the whole thing. So.
Thanks,
And if I
David.
could, sorry,
Go ahead.
just
Go
real
ahead.
quick too. I wish we could spend more time not necessarily like defending against bad policies or bad decision making or things like that, and kind of like David said, could like with the narrative, control the narrative and think about like visioning a better world, figuring out like what policies would help us get to that, and then having people buy into that rather than constantly being on the defense of bad policies coming through. But again, I think we're also overburdened by juggling so many things that makes it difficult. And I think that's part of the system. It's designed to make it that way. But I see more and more of that happening. You know, I think a lot of people would actually agree on a world or a vision, and then identify like, this is how we get to that vision.
Well, yes. And I think that we actually hopefully will have a little bit more of a roadmap for how to get to that vision and what policies will work, because I'm actually going to turn it back and put Dr. Michener on the spot just a little bit again to talk about what she is doing in Kentucky, because I don't really know that we've talked about that today, that actually she is doing a study in Kentucky. And I hope that some of what y'all said today makes its way into there, if that's legal in the rules, and what she hopes the outcomes will be.
Yeah, I mean, this is great. I love the idea of thinking about and developing like an affirmative vision. And I heard a lot of that in Commissioner Miranda-Straub's comments. There was a lot of, I think, envisioning what a different DCBS could look like, and what it would be centered around, and what it would mean for people. And I completely agree. And it is hard that we both have to be like on the kind of defense to protect what we already have, and then on the offense to try to move forward and advance new things. And so the study is really meant to make sure that as we develop our vision of how to improve public benefits, that vision is in a sense like co-developed and co-produced with the people experiencing those benefits. I mean, I think that the conversation that we've had with you all, Kiesha and David and Celine, over the last few, I don't know how long it's been, half hour or what have you, we could keep going. But I think that one of the things that really emerges from that is just how much people who are receiving benefits have to say, how many insights they have, how much they understand about the systems that they're navigating, and how much we can learn from them, so that when we're developing like a roadmap and a vision for policy change, we're not just pulling it out of the thin air or doing what we think makes the most sense, but we're drawing on the experiences, not just of beneficiaries, but also the staff. I love that the commissioner talked about and really humanized like the workers who are being underpaid and who are engaging in what is a taxing emotional labor and facing all kinds of challenges and frustrations. So at the core of the study is the idea that we want to learn both from the people who receive public benefits and the people who administer them, what is going well, what isn't working, what do the challenges look like? And we have a sense of that already. I mean, David was talking about just how hard it is, and how many loopholes you have to jump through, or burdens you have to surmount in order to be able to receive benefits. I think the commissioner has talked a bunch about essentially bureaucratic disentitlement, right? You have a benefit that you're entitled to, but bureaucratic procedures and regulations prevent you from being able to receive that benefit. And it doesn't mean like, hey, if you're not willing to jump through the hoops, you didn't really need it. I've talked to people who are like, yeah, I had an epileptic seizure because I didn't want to bother jumping through the administrative hoops. People have so much going on in their lives. They're already overwhelmed in many ways. And then to say you have to climb a mountain to get access to a basic resource that many other people in society have, well, some folks won't climb the mountain, even if they really, really need to. And so the question is like, what are the nuts and bolts changes that we can both make and then institutionalize, so that some of this is different, and to make sure that those changes are really effective and they're not, because sometimes we can improve something, oh, we're gonna have a policy regulation or change, we're gonna improve it. And then you talk to the folks on the ground and it only made their lives harder, or something else popped up, it's whack-a-mole. Now this other thing is wrong, and one of the ways that we can, I think, forefend against making attempts to reform or improve things that don't really help or that only make life more difficult is to get as much knowledge as possible from people who are most directly involved in the system. So we're doing interviews with staff and with workers at agencies all across the state so that we can, and then, taking that data and analyzing it systematically to find out what are the common challenges that are emerging. And then we can have like a real informed basis for thinking about what kinds of changes need to be made. And I mean, I'm not, I want to help build the knowledge base, but of course, the commissioner and other people here are the ones who are really going to figure out how to go from that knowledge base to actually implementing changes that can be institutionalized, and hopefully some of them that can be sustained even as the political conditions and the political wind shift. Now that's really hard, much more difficult than it seems, but we've been talking about voice and we've been talking about inclusion. And so I think that having those voices and then explicitly incorporating them into processes of trying to think through how to advance, equity and well-being and grow and develop the safety net. That's the goal. And actually, I've been texting even during this session with my project manager, who's telling me about people signing up for the study. And, we're super excited as we're bringing people on board, just getting to really sit with people and listen to their experiences and then amplify that so that it's affecting that affirmative visioning that you were talking about, Celine.
Well, I have to say this may be my favorite session yet, over Zoom, not even in person. And you all, it's just been such a pleasure to spend these past 2 hours with you. Thank you so much for taking your time and sharing your own expertise and experience with us, and giving us so many things to kind of think about as we continue to advocate for a better safety net in Kentucky. And we know that it's possible, not just for the reasons that we've discussed today, but because we had something really good with Connect, in which we saw a simpler way of enrolling in benefits and people there to help you. And so that's really what kept us going as we were fighting all these barriers, with the Kentucky Health Waiver that we've talked about a few times, knowing that we can do it better, we can do it differently, and people can see the value of that public benefit program and, have a good experience getting a benefit whenever there's someone there helping you and making it easy and telling you that, this is a benefit made for you that you deserve and that you should take advantage of. So we want that to be true of all benefits. And so glad to be in a room with so many people who want to advocate for this work. And just want to wrap up and say that we need your help recruiting people for this study. So what you will see in the email that you'll get on Monday will be links to social media messages that you can just share with your networks. We also have some flyers that Dr. Michener, her team created, and we'll be getting those out. If you work for a community-based organization, a provider's office, and you want to pass out like something, paper, hard copy to people in your community, we can get those to you as well. You just have to get in touch with us, and we'll make sure that we get those to you. So I wanted to put in a quick plug for that. And also, of course, today was the first day of our annual meeting. We have another 2-hour session tomorrow, starting at 11 o'clock. It's going to be fantastic. And of course, everything that we discussed today, so much of it rides on what our legislators do, right? Either in Frankfurt or in Washington. So tomorrow, our board chair, Dr. Sheila Schuster, will be moderating a panel as we prepare for the 2022 General Assembly that's starting in January. And I didn't put a slide in here for this, but we'll make sure to include it in the follow-up email on Monday. We're also going to be doing an Advocacy 101 training on January 10th. I hope it's the 10th and not the 9th, Sheila. We can correct that if we need to. And finally, I just wanted to say one more big thank you to our sponsors for supporting this work and for helping us to put this annual meeting on. We really appreciate it. And if you do want to join tomorrow's session and you haven't already registered, it's not too late. I am dropping the link in the chat right now. Again, just appreciate everyone's time today and your participation. This is what keeps us going. I mean, this has made my week. I hope it's made yours. Just big thanks to our speakers and our panelists and to everyone here who does this important work in your communities. So thank you very much. And I hope to see many of you tomorrow.